indulging us into your donations for today. I know we've reached the time of the year where there's donation fatigue sitting in, and you guys are still donating. And thank you for being here, and thank you for donating and supporting the healthcare Sierra Leone and the mission work we do in Sierra Leone. I will have my chairman, Ba, to come and introduce the Honorable Ambassador Sidique Abubakar. Chairman Ba.
Good evening, ladies and gentlemen. I wrote something very small to introduce our great ambassador to the United States of America. Ladies and gentlemen, for the past over 30 years, the individual I'm about to introduce have held several high-level positions in this United States of America. He was the former President of the United African Congress in the United States and also advisor to the Community Affairs Analysis of Africans, an organization that had over 3.5 million people in the New York area. He also served as advisor to the New York City Police Department, NYPD, that have over 40,000 men in uniform, and of course over 25,000 individuals. He was the one in 2012 that advised the New York City Department to implement the body camera today that every single police officers are using across this great country. He has also facilitated high-level safety meetings between the New York Police Department and, of course, with other African ambassadors to the United Nations. He has also championed for the New York Police Department to look at Sierra Leone through the West African Marlon River Union so they can use Sierra Leone for training. And of course, during the Civil War of 1991 to 2002, our ambassador played a very important role to help our government officials who were captured by rebels for them to be released. In 2013 to 2016, when the Ebola crisis hit Sierra Leone, hit Sierra Leone, he played a very important role in New York through the United Nations to make sure Sierra Leone has the right medication so our people's life can be saved. There is so much to talk about our ambassador. Even in 2018, he hosted the first investment forum for Sierra Leone in New York. Today, when His Excellency took over Sierra Leone, there is no better person in the United States to hold that position to serve as an ambassador than this individual. There is so much to say about him. Personally, I had an opportunity with him when I served as the regional chairman for the Sierra Leone People's Party here in North America, and I know the role he played to make sure everything goes well. Ladies and gentlemen, please put your hands together for His Excellency, the Sierra Leone Ambassador to the United States, Ambassador Sidique Abubakar.
Wow.
Thank you so much.
Give a big round of applause to the best chairman we've ever had, my good friend and brother, Chairman Ba. I think we are not in church, are we? No, let's go. Let's go. I think, make believe, even if you don't like each other, turn around and say, thank you for coming tonight. Let's shake everybody's hands. Please do that first. Ladies and gentlemen, the most distinguished chairman of Healthcare Sierra Leone, the pioneer and leading healthcare organization that I, as ambassador, recognize as the frontier of quality healthcare and access in America. Give the chairman a big round of applause. And as you are giving him, the chairman, a big round of applause, please give the First Lady a big round of applause as well. And the Honorable Minister, my colleague in government, the Honorable Timbo, the most loyal and distinguished Vice Chair, Dr. Fuad Sharif, and all those incredible human beings that got awards tonight. Please give them a big round of applause for the work that they do. And ladies and gentlemen, yesterday I was ordered by the distinguished chairman to come to this great state. When I got to the got off of the airplane, I deplaned, and I got somewhere. I mean, you guys have everything here is so huge. The airport is big. The streets are wide. And look at this room. It's so huge. But I have to say this from the bottom of my heart. There is no place in America that I would choose to be today than here. So, Mr. Chairman, and all of you, esteemed members of Healthcare Sierra Leone, UAC, distinguished guests, fellow citizens, and attendees, good evening. I didn't hear you respond. Good evening. I bring you greetings and the best wishes from His Excellency, President Dr. Julius Maada Monimbil, and the staff of the Embassy of Sierra Leone to the United States. Before I do anything, all those people serving, I want you to stop. I want everybody to rise up and give 1 minute of silence in silent prayer to the late Dr. Rogers, who gave his life to this organization and to our country. May his soul rest in peace. Please have a seat. Thank you. Distinguished guests, I am honored to be here this evening at the kind invitation of the leadership to address you today about a vision that has the potential to transform healthcare and access in Sierra Leone. As we gather here, I want to now acknowledge the tireless effort of Healthcare Sierra Leone and all its members over the years in conducting medical missions and improving quality healthcare and access to our people in Sierra Leone. Some of you in this room own and operate clinics and help retail businesses in Sierra Leone. Some of you have created and treated Sierra Leoneans at home and also here. However, despite our individual efforts, our country still faces significant healthcare challenges. The statistics, ladies and gentlemen, is alarming. Sierra Leone has a maternal mortality rate of 443 deaths per 100,000 live births, down to 717. Let me repeat that. Sierra Leone has maternity rate of 443 deaths per 100,000 live births, down from 717. But still unacceptably high. Our infant mortality rate remains among the highest in the world. We lose talented healthcare professionals to brain drain, and our infrastructure struggles to meet basic needs. Just turn around in this room. All the people that got the awards today. If I had my wish, I wish I could get a plane given to me and grab all of them and take them to Sierra Leone and say to the dogs, here are your children, they are here to serve your country. But I don't think that is possible. And that's what I want to talk about tonight. In fact, hospitals, clinics, and community healthcare pros are running bare of essential tools and professional medical practitioners in the country. Many do not even have medicines to provide for those in desperate need. At the same time, some unscrupulous healthcare workers and other actors sell counterfeit drugs to patients without a prescription. The COVID-19 pandemic has further exposed the weaknesses in our healthcare system, with 7,779 reported cases and 126 deaths as of today. The exposure to the synthetic cocktail drug Kush continues to rob our nation of our youthful population through untimely death. There was one instance in Sierra Leone on one day. They buried 300 young people on that same day as a result of Kush. With these painful public safety challenges, it is time, ladies and gentlemen, for bold action. And today, I want you to join me in envisioning a state-of-the-art medical practice plan in Sierra Leone as a hub for quality care, medical education, and economic growth. This is not new among African diaspora communities in the USA. Let me give you an example. 350 Ethiopian doctors raised $100 million to establish a state-of-the-art medical treatment and research cancer treatment center in their country. Do you want to tell me that they are smarter than you? No. These 300 Ethiopian doctors, they practice like any of you. There are doctors in this room that make over $350,000 a year. There are nurses here who are even making that more. Where are they from? Can you help me? Where are they from? I didn't hear you. And some of them are from my village, Wagoma. So, how did the Ethiopians do it? What the Ethiopians did, they went to their doctors and their nurses and said to them, 350 of them, he said, put in $35,000. They wrote the check for $35,000. They raised $25,000 together. And then they went to their prime minister then, Meles Zenawi, and said to the prime minister, we want you to talk to the banks to give us $75 million to round it up to $100 million. That is how they raised $100 million to build a state-of-the-art medical and research center in the country. I can guarantee you, if you did that here, I, as your ambassador, will team up with you for a first-class presentation to President Dr. Julius Maada Bio. I can assure you the President will welcome you and give you all the support you need to produce a state-of-the-art healthcare center in the Republic of Sierra Leone. But it's got to start with you. We can no longer act in silos. You heard the gentleman from Korea standing here to say that they started small and now he's supplying the world. It takes a leadership. And when they say leaders, they also have to be followers. So all of you, I beg you, you must work together. In establishing this center of excellence in our country. During the recent meeting that I had with the Minister of Education, Minister of Health, my good friend Dr. Austin Dempsey, he said to me, he says, my brother, Ambassador, let me send you a message to my brothers. He says, Sierra Leone has the best brains, the best doctors, that are working in the best institutions of excellence in this country. He said, could you please tell them to work together and build a state-of-the-art medical and research center in the country that they own, they operate, they run. That is the message. The Minister of Health said, let me give it to you. I'm only a messenger. Imagine a facility with cutting-edge diagnostic equipment, modern surgical suites, and specialized services, a place where patients receive comprehensive care regardless of their economic status, where medical professionals can train, upskill, and stay updated on the best practices. Working in silos is not the answer. But when you work together, that is the answer that you need as medical professionals to help your country. This vision is not just a dream, ladies and gentlemen. It is achievable. With partnership between government, the private sector, and international organizations. Yes, we can. And follow me when I say this. Yes, can we attract investment and expertise in Sierra Leone? Please follow me. Yes, we can. Let me say that again. Can we attract investment and expertise in Sierra Leone? Yes, we can. Can we leverage funding from organizations like the Islamic Development Bank Group and the Swedish International Development Corporation? Yes, we can. I'm not done yet. And most recently, that Swedish institution donated $430,000 in medical supplies in Sierra Leone. Can we together create jobs and stimulate economic growth? Yes, we can. Can we create thousands of jobs that will contribute to the GDP of Sierra Leone? Well, with the knowledge and expertise that you have gained in the Americas, they can do it as a collective private healthcare infrastructure that would enhance medical education and research, collaborate with institutions like the College of Medicine and Allied Health Sciences to improve healthcare systems in Sierra Leone. You will improve patient outcomes and satisfaction, ensure access to quality care, and reducing maternity and infant mortality rates in the country. To make this vision possible, I now propose the following. Number one, conducting a feasibility study to identify optimal locations and partnerships in the country. Among you, starting with you. Number two, establish a public-private partnership framework. Number three, develop a comprehensive business plan. Number four, engage international organizations and donors. Number five, partner with your rich friends through and encourage them to invest. And number six, I will be happy to introduce this leadership to the Ethiopian Medical Association, who have already done what you plan to do. That leadership, by the way, is headed by my own mentor, Dr. Mohammed Nur Hussein, who started this whole thing. Well, let me close, because I think people are looking at me. I think I've paid for this mic because I raised some money for healthcare services. And I came here with an appeal. And that appeal is a simple appeal. The president established a commission to eliminate Kush. The ministry has tried. But I know when you, the best diaspora anywhere Sierra Leoneans are, anywhere in the world, you are the best diaspora who love and care about your country. What I'm here to ask Healthcare Sierra Leone leadership is that at an embassy, we cannot lead this. We want to take the honorable and the humble position of inviting your chairman, the distinguished chairman, Dr. Pierre, to be the chairman, Healthcare Sierra Leone, to be the leadership of this mobilization to end Kush in Sierra Leone diaspora in our country. Can I get an amen? Can I have here a public confirmation that Dr. Pierre, that you accept that responsibility, sir? Well, give yourself a big round of applause. So, I hear the minister has heard what you've said, and you all have agreed. We convene parliament. We are not submitting cabinet paper, we are submitting the people's paper. And that is all of you nurses, all of you doctors, under the leadership of Healthcare Sierra Leone. I commit, as your humble ambassador, to support this initiative to do three things. I will bring international partners to this effort. Already the Sierra Leone, the United States ambassador to Sierra Leone is on board. Second, USAID is on board. Third, the Interfaith Religious Council in the Americas are on board. Nurse practitioners are on board. Doctors from different medical colleges, I have recruited them. They are on board. Just like you did with COVID, Healthcare Sierra Leone led the fight under the late Dr. Michael Rogers as chairman, that we did the largest donation to Sierra Leone of any diaspora anywhere, up to the tune of $7.5 million in goods and services. We could do it again. So now that I came today, I'm leaving tomorrow, and that I have gotten what I want, I raised some money for Healthcare Sierra Leone. And number two, Healthcare Sierra Leone chairman has accepted the leadership. And when I go back to Washington tomorrow, I am going to write an official letter in my capacity as your president of Sierra Leone in the Americas, that Dr. Pierre, Healthcare Sierra Leone is the leadership in mobilizing the diaspora to fight Kush in this United States. Ladies and gentlemen, Give yourself a round of applause and thank you for the opportunity. And let me have a presentation to make to Dr. Pierre. Here is. You give him extra one, sir? No, sir. Here is 105-page encyclopedia edited by my policy advisor. Me and her co-wrote an article on health for Sierra Leone, and the foreword was written by the president of Sierra Leone, Dr. Julius Maada. So it's about 500 pages, but I just took the section. I want to present this to Healthcare Sierra Leone, to the chairman. Of course, I may be an ambassador, but I'm also a scholar too, Mr. Chairman.
Thank you very much, His Excellency, my friend, my brother. You know, I don't like to say too many words. I believe in actions. For on behalf of this wonderful organization, I want you
I'm sorry, Chairman. You know, we're here to raise funds. I was told that our brothers and sisters from Sierra Leone in Michigan would like to donate some money. Who is representing Sierra Leone in Michigan here? Give them a round of applause. Yes, please come up and let's receive your donation.
Members can also come with her.
Members, Mr. DJ, or Madam DJ, can you give us, Mr. DJ, can you give us a good music so we could welcome these Sierra Leoneans in Michigan that's going to be giving us hopefully $100,000.
My name is Regina Ali, and I'm the treasurer of Sierra Leone Association of Michigan, under the leadership of Ms. Bridget Bayo, who you've already met. And we are so happy for this occasion. Bridget has told us about this early on in the year. And we are not functioning like an organization this past year, but under her leadership, she's gotten some of us excited about this. Every year we have our independence. We select an organization in Sierra Leone, and for the past, before COVID, we would send 5,000 to Sierra Leone. So when she brought up this thing about this organization, and from what we've heard today, we know that they've done a fantastic job. We know there's a lot to be done. And who knows, maybe our next independence will do something for healthcare, Sierra Leone. But we cannot let this occasion go by without, let me say, put your money where your mouth is. So we are making a donation to Healthcare Sierra Leone in the amount of $1,000.
Thank you, Slam, for supporting my Healthcare Sierra Leone. Thank you so much. Thank you.
Thank you, our brothers and sisters of Sierra Leoneans in Michigan, for your generous donation.
Ladies and gentlemen, I know the night is fast spent, so we're going to cut some few agendas here and go to the nitty-gritty things. We're going to be dancing tonight till 2 o'clock, right?